Hi, my name's Lara. I'm a trainee advanced clinical practitioner for Medvivo.
Hi, I'm Steve Faulkner. I'm a paramedic background and work here at Medvivo as a trainee ACP.
My name's Chris Berry. I am a trainee advanced clinical practitioner and I'm also the non-prescribing team lead here at Medvivo.
I originally started for Medvivo as a pre-reg. I was a second year student nurse. I worked for them as a healthcare assistant in the out-of-hours team. I supported out-of-hours clinicians doing observations and basic assessments such as urine dip.
I've been working here for the last 2 years. Initially I started as bank, and now I've got a full-time career here at Medvivo. I currently do start off as clinical responding, so face-to-face visits with patients in the community. And then I started to work on the triage, so telephone triage, where again I can take calls and complete alternative care pathways for patients and try and avoid hospitals if we can, but mostly it's dealing with very kind of primary or sometimes even urgent care work as well.
I initially came as a clinical responder, which was a developing role really, which was a non-prescribing clinician going and performing home assessments under the supervision of an ACP or GP.
I then went off and got some experience in primary and secondary care. I was a practice nurse in a GP surgery, covering minor illness clinics and other things in GP surgery, and then joined the local A&E department as a staff nurse and got some secondary care experience there. I then rejoined Medvivo as a trainee clinical responder on a developmental pathway, providing care for patients in their homes. Subsequently had lots of support from Medvivo. They supported me clinically and academically to get me up to the level to be a clinical responder. I then got myself on the master's programme to be an advanced clinical practitioner.
I then was accepted on the apprentice ACP course through Medvivo, and so they've been now promoting me and helping me through this by doing trials on face-to-face appointments at the surgeries in the out-of-hours, more help and assistance on triage, and also now doing the care coordination as part of the Medvivo and trying to help South West Ambulance Service to try, if possible, to help discharge non-conveyance to patients to hospital.
Medvivo have supported me by giving me a mentor through the 3 years. They have also provided some sponsorship and mentorship for my prescribing. So I have just joined the register as a new prescriber. And subsequently they have provided a preceptorship, new developmental plan to transition me from being a new prescriber into the prescribing team, working alongside the GPs, ACPs and other professionals.
Then once I start my prescribing course in September, it then gives me a bit more autonomy to be able to prescribe medications to patients that are required. Whereas at the moment my role is when I feel that a patient requires support with medications, I then have to speak to one of the clinical navigators or other ACPs or nurse practitioners within Medvivo to get a prescription completed.
So I've just started to prescribe. Medvivo have been really fantastic in assisting me during that change, and I've always got a clinical supervisor that I can call to discuss any clinical decisions or prescribing decisions with. Medvivo have been really great in providing me this opportunity that prior to the pandemic I would have never really thought of.
The advantage of working for Medvivo is the multidisciplinary team we do have here, and what they do is they allow shadowing and clinical support in lots of varied roles. I hopefully will qualify as an advanced clinical practitioner next year after finishing my dissertation module, which Medvivo have very kindly supported me through. So I will stay with Medvivo, which is fantastic.